The holidays have already been so different for us, and a vaccine is on the way. However, we do still need to be taking the proper steps to protect our loved ones and those who are most vulnerable. So we're bringing in geriatric Dr. Kathleen Rogers from the Cleveland Clinic to talk more about the impacts of COVID-19 during the holidays. So Dr. Rogers, thank you so much for taking the time to be here. Let's start with what we're already seeing left over from the Thanksgiving holiday.
Hi, thank you so much for this opportunity. After the Thanksgiving holidays, there have been many people that have been traveling, and we have seen an increase in numbers of patients with COVID-19. Many of them have been hospitalized, and many of these hospitalized patients are elderly patients. According to recent CDC analysis from May to August, many of the patients that were hospitalized, about 114,000, 78% of these patients were 65 and older, and therefore increasing, just being more, it's obvious that the patients that are mostly affected are patients who are at risk, which are elderly and frail.
Absolutely. And I'm curious, why are the older patients so much more vulnerable, and what have you seen in your patients?
Well, as you get older, your body also ages. And with that comes different diseases like diabetes, you have hypertension, cardiac disease, obesity, and arthritis. And as a result, your body's already dealing with these diseases. And as you get older, the risk of getting more severe disease also increases. Patients who are 85 and older are at the most risk of contracting severe illness of COVID-19. And that's why in my practice, I usually tell my patients to be very, very careful in, especially celebrating the holidays and, being with loved ones who may have even very mild illness, but may manifest as more severe illness when it is transmitted to an elderly loved one.
Yeah, and as cases continue to rise, the one thing we're hearing is to avoid large gatherings, and maybe this isn't the holiday to spend time with your loved ones. But I am curious, what are the risks of that? But what are the benefits of maybe even just reaching out? Because these are our elderly population. They're used to seeing us during the holidays, and this one they might not get to.
This holiday is a tough season, especially with our elderly relatives. We do love being with them, with grandma, grandpa, our neighbors, and humans. We are relational people, and especially during the holidays, it's tough. I mean, take the pandemic as it is, and people are already isolated and, being away from family members and friends, and they don't have a routine. People who have retired change routine. And if you are elderly, a lot of times the routine change can in itself cause a sort of isolation and change to your own mental health. With the holidays being here, it is a tough one because with the pandemic isolation already and not being able to see your loved ones, a lot of people, especially the elderly, may feel the weight and the burden of not having that relationship and being able to sit at the table and just have a meal and, share stories by the fireplace. Or open gifts together. But there are many, many creative ways that we can actually, be with our loved ones. There's technology that's available. There are many apps, and there are senior-friendly devices that are just one button, of a senior-friendly. It's not very complicated, basically. So I've been encouraging a lot of my patients to just do, to use technology, whether it's the phone or, a tablet to connect with their loved ones.
If family and friends do decide that they are going to gather, what is the recommendation and the precautions that they use?
If you're going to gather, first of all, look at your own symptoms. If you have even mild symptoms, if it's a sniffle, a stomach bug, it would be better to plan for a social distanced holiday and not even visit your loved one.
Yeah.
And also consider the health risks of your loved one that you are going to see, especially if they're frail, if they have diabetes, they have heart disease, they're obese. These are some of the main factors that can cause severe illness, and especially if they're very elderly. But if you must go see your loved one, make sure you take the appropriate precautions, such as wearing a mask, washing your hands, using hand sanitizer, and trying to stay away from your relative, even you're in the same home, as much as possible. And make sure when you clean surfaces and take care of their home as well, that they're watching out for them.
How exactly do you make it less painful to tell your relatives that you're not going to spend the holidays with them, especially our elderly relatives?
I don't think there's an easy way to make it any less painful as it is, but possibly finding common interest. So if grandma likes to cook, you could find a tablet that you could call in, whether it's FaceTime or whatever app you want to use to video chat. You could make a meal together. I know I have some patients that actually choose books during this time, or even watch movies at the same time together. Once they're done, they actually discuss the book or discuss the movie, and they even have Zoom little parties where the whole family can get together. They can look at each other, and they just have a lot of fun. So the moral of the story is just be creative this season. There is a challenge, but you can be creative, and there are a lot of tools at your fingertips that can be used.
Dr. Rogers, thank you so much for your time. Yes, something as even as simple as a phone call is one way to reach out to our loved ones during this time as we round out 9 months of going through this. So we appreciate you joining us here on NBCLX.
Thank you.
So you voted. Now what?